So a recent report revealed that more women died during pregnancy in Louisiana than any other state.
The mortality rate is even higher in Black and brown communities, but a new bill created in honor of a local woman could help address that problem. Perry Robinson has more on this. Perry.
Hey guys, a separate report found that 80% of pregnancy-related deaths are preventable. That's why lawmakers created this new bill to hopefully save more women across the state.
If they had just listened to her the first time and took her back, I believe fully that she's still sitting here.
Baton Rouge NAACP President Eugene Collins is no stranger to fighting and advocating for others. But this battle is a new one. In March 2020, his sister Jessica was pregnant with her second child, Jace. Eugene says she was having some trouble, so she went to the ER.
My sister went to the hospital, to the emergency room, and the emergency room actually sent her back home.
But on her way home, his mom told his sister to turn around and go back.
My mom, who worked for a physician here locally for a number of years, she's had some medical training, so she heard the symptoms. She's like, nah, go back to the hospital.
Sadly, she never made it back home.
The time frame is unknown how long she sat there, but she went back to the emergency room. They set her back in the waiting room, and she sat there and had a stroke. She was a little bit of a bigger girl, right? Witnesses tell me that hospital personnel then drug her across the floor on her stomach to get her in the back.
Eugene says both Jessica and the baby passed away just days apart.
We should not be in a state or live in a place where more Black women and Black babies walk into a hospital, but less of them walk out.
Pregnant Black women have died at a higher rate compared to any other race, according to LDH, and those numbers have doubled over the last 20 years. To help improve health care options for future mothers, Governor Edwards signed the Jessica Collins-Ruffin Act, named in honor of Eugene's sister. This opens the door for more women to turn to a midwife for their pregnancy needs by offering Medicaid reimbursements. This means more low-income families will have access to midwife services than ever before.
What this will do is give birthing people greater choices of who they want to support them through their pregnancy and their postpartum period.
Leaders say this new option is a start in addressing this ongoing problem.
They may not want an OBGYN, they may want a midwife to support them. And now, with increased reimbursement rates through Medicaid, hopefully more midwives will accept Medicaid and more midwives will continue their practice because it's actually more sustainable for them.
Collins says the system failed his sister, but he thinks this is one of many ways to fix the issue.
That is a problem, and you will continue to see poor birth outcomes if we don't value and respect and listen to and trust Black women about our own health and our own bodies.
Well, leaders hope this is just the start of future legislation to come to address this crisis. Guys, back to you.
All right, Perry, thank you for that.